And what's something you've heard here at the conference that was interesting or insightful?
Sure. So something I heard at the conference that was very insightful to me is when we're exchanging data, it's fairly easy to exchange data following the 3P rules, which is payer to payer, provider to provider, and patient to patient. Where it gets a little dicey is when you mix up the P's and you start sharing data from the payer to the provider to the patient, or the provider to the patient. And I think that really sets a stage for where we can move forward, and some of the conversations should be built around this is how can we better interoperate, how can we better get the data that we need to in the patient's hands. And I think that we're going to kind of see more conversations like that happening in the next few HIMSS to come.
I would say that the big difference has been that before people were talking about we will build, we're working on, and now it's more the actions, being actionable, and that this is what we're doing right now. This is available. This is an example. So it's been from talking about it to working, doing it, showing it, meaning interoperability is really here now.
I was very pleasantly surprised at how consumer-oriented the industry has become. If you look, when I started, you could tell I'm not a youngster. I started in the industry about 40 years ago, and it took the industry a long time to be patient-centric. We always focused on the physician. We always focused on the hospital, the four walls of the hospital. Then we broke beyond the four walls of the hospital. And it's only recently that we've come to become consumer-focused. A lot of focus on front door to care, on consumer experience. And when I look at my kids' age group, Gen X, thereabouts, and even my grandkids, they aren't going to put up with the inability to be recognized and known. Do you know me? Do you know my background? Do you know who I am? Let alone, do you know my medical record? Do you know that I did this and that a number of years ago? So to me, having that mindset in the industry is refreshing, and I'm seeing more and more of it out there.
And what's one thing or a couple things that you've heard here at HIMSS that stand out to you?
I think the focus on clean data and data bias has been a reoccurring theme I've heard throughout the conference, which I'm kind of glad about. Also, the type of API solutions and that type of thing that I've seen, I think are impressive. I will say I was a little disappointed in some of the vendors who came with the same ideas and the same solutions they had in the last 5 years. I don't think that's the best use of their time here. But for the most part, the ones that I've met that are new to the space came with an idea to showcase put their best foot forward, and I'm kind of glad they showed up this year.
We've been hearing a lot about AI and machine learning, and to be perfectly honest, healthcare is a little bit behind in those particular areas. So we're hearing a lot of buzz about incorporating AI into finding patients, searching for populations of patients, and making sure that they're treated appropriately.
So what's one thing you've learned, an insight or perspective you've heard at HIMSS?
Okay, so I just got out of a Leading Through Turbulent Times session, and it was how to inspire future generations of female executives. And one stat or factoid that I learned was that there are technically a larger absolute number of female grads in the tech space, but percentage-wise, we're losing ground. And so currently there's only 25% of all college grads that are going into technical or STEM careers, and we're never going to make up the gap at that rate. So it's definitely something that if you have daughters or women in your family that are in college, encourage them to join STEM careers.
Well, HIMSS is sort of interesting this year, obviously, small but mighty, if you will. I had a conversation with the CMIO of a large hospital system, and he was referencing that he expects COVID to be with us for a period of years, perhaps perpetual in different, mutated states, and vaccines trying to stay ahead of it, and peaks and valleys, kind of occurring here. This is somewhat a new normal. It's tragic. It's unfortunate. And again, I think we're going to have to live in a world of more digital, virtual tools and care delivery, contributing into this healthcare economy.
I actually heard it has exceeded our expectations. I've heard that time and time again. I think that's what makes me feel good. They're like, even with the mask, I feel like it's a return back to normal, a return back to face, a return to community. So I think that's the one big conversation point I've been having with people.
I think remote patient monitoring is absolutely a hot topic. You've got something that adds value to a healthcare practice and to the patients, and which is being reimbursed. We don't see those collide enough. And we're seeing a lot of companies doing lots of interesting things, from, of course, devices to things that are more automated, to nursing support, et cetera. But I think remote patient monitoring is going to be a very big part of the next year in a variety of ways, from devices to services, technology, et cetera. And it's going to help both physicians be more efficient in their offices, and patients have a better quality and engagement experience with those offices.